Question 1. Exercise physiology, energy systems and metabolism. During high-intensity 100-meter sprint, which energy system is primarily responsible for providing the necessary app for muscular contraction? A. Oxidative aerobic system. B. Glycolytic anaerobic system. C. Phosphagon APC system. D. Beta oxidation. Answer: C. Phosphagon APC system. Explanation: the phosphagon APC system is the primary energy system used during short, high-intensity activities lasting around 1015 seconds, such as 100-meter sprint or maximal power lift. This system relies on stored adenosine triphosphate (AP) and phosphocreatine (PCR) in the muscles, providing an immediate and powerful energy source without requiring oxygen. Glycolytic anaerobic system B becomes dominant in activities lasting 15 seconds to 2 minutes, such as 400-meter run, producing AP through anaerobic glycolysis, which results in lactic acid accumulation. The oxidative aerobic system A is the dominant energy pathway for long-duration, low-intensity activities, e.g. marathon, utilizing carbohydrates and fats in the presence of oxygen to generate AP. Beta oxidation, D, is the process by which fatty acids are broken down for AP production, which is too slow for high-intensity activities like sprinting. The relevant guidelines, ACM, American College of Sports Medicine, outlines that high-intensity short-duration movements primarily rely on the APC system, while prolonged exercise depends on aerobic metabolism. NASM, National Academy of Sports Medicine, states that the APC system is essential for explosive movements such as sprinting or Olympic lifting. Question 2. Injury prevention and rehabilitation. Recovery and regeneration. Which of the following strategies is most effective for reducing muscle soreness and enhancing muscle recovery after an intense resistance training session? A. Passive rest and complete immobilization. B. High-intensity training on consecutive days targeting the same muscle group. C. Active recovery, hydration, and adequate protein intake. D. Ignoring soreness and pushing through additional workouts to build tolerance. Answer: C. Active recovery, hydration, and adequate protein intake. Explanation: muscle recovery is critical for preventing injuries and optimizing performance. The most effective post-exercise recovery strategies include active recovery, light movement, e.g. walking, cycling, or stretching. It helps increase blood circulation, reducing lactic acid buildup and promoting muscle repair. Hydration, replenishing lost fluids and electrolytes. Muscle cramps and dehydration-related fatigue. Protein intake. Consuming 2040 grams of protein post-exercise supports muscle protein synthesis, MPS, and repair. Option A. Passive rest and complete immobilization can lead to stiffness and reduced circulation, prolonging muscle soreness. Option B. High-intensity training on consecutive days without adequate recovery increases the risk of overtraining and injury. Option D. Ignoring soreness and pushing through can lead to muscle strain, chronic fatigue, and burnout. Relevant guidelines. NSCA National Strength and Conditioning Association recommends 8 hours of recovery for the same muscle group after intense training. ACE American Council on Exercise supports active recovery and hydration as essential components of post-exercise recovery. Question 3. Scenario-based. Special populations. Exercise modifications for medical conditions. John, 55-year-old client with hypertension, has recently joined your personal training program. During cardiovascular endurance session, he mentions feeling slightly dizzy and lightheaded. You immediately stop the session and assess his condition. What is the most appropriate course of action? A. Encourage him to push through the discomfort, as it's likely just fatigue from exercise. B. Have him sit down, monitor his blood pressure, and ensure he is properly hydrated. C. Immediately call 911, as any dizziness during exercise is sign of life-threatening emergency. D. Reduce the session's intensity slightly but allow him to continue exercising. Answer: B. Have him sit down, monitor his blood pressure, and ensure he is properly hydrated. Explanation: clients with hypertension, high blood pressure are at a higher risk of cardiovascular events during exercise. Dizziness and lightheadedness can indicate dehydration, blood pressure fluctuations, inadequate warm-up, or overexertion. The correct response is have him sit down in a cool, shaded area to prevent fainting. Monitor his blood pressure. Equipment is available, and check for further symptoms like nausea or chest pain. Encourage hydration, as dehydration can cause a drop in blood pressure leading to dizziness. Option A, encouraging him to push through is dangerous and could lead to syncope, fainting, or a hypertensive crisis. Option C, calling 911 immediately is not necessary unless symptoms worsen, e.g., chest pain, confusion, or loss of consciousness. Option D, reducing intensity but continuing the workout does not address the underlying cause and may increase risk. Relevant guidelines. Axum guidelines for hypertensive clients. Trainers should stop exercise if dizziness occurs and ensure proper hydration and a gradual warm-up and cool down. American Heart Association (AHO) recommends monitoring blood pressure before and after exercise for individuals with hypertension. Question 4. Exercise science and human anatomy. The cardiovascular system plays a crucial role in delivering oxygen and nutrients to muscles during exercise. A well-trained endurance athlete often exhibits a low resting heart rate and a higher stroke volume than an untrained individual. Which of the following physiological adaptations is most responsible for the low resting heart rate observed in endurance-trained athletes? A. Increased sympathetic nervous system activation, leading to greater cardiac output at rest. B. Greater myoglobin content in the muscles, reducing the need for cardiac output. C. Increased left ventricular hypertrophy, leading to a higher stroke volume per beat. D. Decreased parasympathetic tone, allowing for faster recovery between heartbeats. Answer C. Increased left ventricular hypertrophy, leading to a higher stroke volume per beat. Explanation. Endurance training leads to an increase in left ventricular hypertrophy, which allows the heart to pump a larger volume of blood per beat. Stroke volume. This adaptation means the heart does not need to beat as frequently to meet the body's oxygen demands at rest, resulting in low resting heart rate. Increased parasympathetic tone, decreased as in option D, also contributes to this effect. Myoglobin content, option B, is primarily relevant at the muscle level, not the heart, and sympathetic nervous system activation, option A, would increase, not decrease, heart rate. Question 5. Biomechanics and kinesiology. A client is performing a barbell squat and you notice that their knees cave inward during the movement knee valgus. This improper movement pattern can increase the risk of injury, particularly to the axial and medial knee structures. Which of the following corrective strategies would be most effective in addressing this movement dysfunction? A. Strengthening the gluteus medius and external rotators to improve lateral hip stability. B. Increasing quadriceps activation to prevent excessive knee flexion. C. Reducing ankle dorsiflexion by restricting tibial movement forward during squats. D. Encouraging a narrower stance to force the knees to stay in line with the toes. Answer A. Strengthening the gluteus medius and external rotators to improve lateral hip stability. Explanation. Knee valgus is often caused by weakness in the hip abductors and external rotators, particularly the gluteus medius. Strengthening these muscles can help prevent excessive medial knee movement. Quadriceps activation, option B, is not the primary issue, as weak or imbalanced hip muscles are typically the root cause. Restricting dorsiflexion, option C, could make squatting more difficult and may lead to compensation patterns elsewhere. A narrower stance, option D, does not necessarily correct knee valgus and could limit stability. Question 6. Scenario-based question, program design and exercise prescription. James, a 52-year-old client with a sedentary lifestyle, has recently been diagnosed with hypertension. He is motivated to begin an exercise program but is concerned about the safety of resistance training and high-intensity workouts. His doctor has cleared him for moderate-intensity exercise. Which of the following is the best approach to designing his initial work? A. Incorporate high-intensity interval training, 8 sessions to improve cardiovascular efficiency quickly. B. Focused primarily on heavy resistance training, 85-90% of ONOM, to improve strength and circulation. C. Design a program consisting of moderate intensity aerobic training, 40-70% ATR, and light to moderate resistance training, 50-70% ONOM, with breathing. D. Avoid resistance training altogether and focus solely on low intensity steady state LISP cardio exercises. Answer C. Design a program consisting of moderate intensity aerobic training, 40-70% ATR, and light to moderate resistance training, 50-70% ONOM, with controlled breathing. Explanation. For hypertensive clients, moderate intensity aerobic exercise and light to moderate resistance training are recommended. This approach helps lower blood pressure while improving cardiovascular health and muscular endurance. It option A, may cause excessive blood pressure spikes and is not ideal for beginners with hypertension. Heavy resistance training, option B, can lead to dangerous blood pressure elevations. Avoiding resistance training altogether, option D, is not necessary as strength training has been shown to have long-term benefits for blood pressure control. Question 7. Nutrition and supplementation. A personal training client wants to lose weight while preserving muscle mass. She has read about various dietary strategies, but is unsure which approach would be most effective for fat loss while maintaining lean muscle. Which of the following nutrition strategies is most supported by scientific evidence for preserving muscle mass while in a caloric deficit? A. Consuming a high-protein diet, 1.6 2.4 grams body weight, combined with resistance training. B. Following a very low-calorie diet with minimal protein intake to speed up fat loss. C. Eliminating all carbohydrates to force the body to rely entirely on fat for energy. D. Avoiding post-workout protein intake to enhance fat metabolism during recovery. Answer A. Consuming a high-protein diet, 1.6 2.4 grams body weight combined with resistance training. Explanation. When in a caloric deficit, a high-protein intake, 1.6 2.4 grams, helps maintain lean muscle mass, especially when paired with resistance training. Very low-calorie diets, option B, often lead to muscle loss along with fat loss. Eliminating carbohydrates, option C, is not necessary for muscle preservation, and avoiding post-workout protein, option D, can hinder muscle repair and growth. Research shows that adequate protein intake combined with strength training is the most effective way to preserve lean mass. Question 8. Special populations and considerations. Which of the following exercise modifications is most appropriate for a pregnant woman in her second trimester who wants to continue resistance training safely? A. Performing supine exercises to maintain comfort and spinal alignment. B. Engaging in isometric core exercises like planks to strengthen the abdominal muscles. C. Avoiding overhead lifts and switching to seated resistance exercises to reduce strain on the lower back. D. Encouraging Valsalva maneuver techniques to enhance stability during lifts. Answer C. Avoiding overhead lifts and switching to seated resistance exercises to reduce strain on the lower back. Explanation. During pregnancy, the center of gravity shifts, increasing strain on the lower back. Avoiding overhead lifts and switching to seated resistance exercises can help maintain balance and reduce spinal stress. Supine exercises, option A, should be avoided after the first trimester to prevent vena cava compression. Isometric core exercises like planks, option B, may be safe but should be performed cautiously to avoid excessive intra-abdominal pressure. The Valsalva maneuver, option D, should be strictly avoided as it can lead to excessive blood pressure spikes and reduced oxygen flow to the baby. Question 9. Injury prevention and rehabilitation. A client complains of persistent shoulder pain when performing overhead presses. Upon assessment, you notice limited shoulder mobility and possible impingement. Which of the following modifications would be the most appropriate initial step to address this issue? A. Reducing the range of motion and substituting the exercise with to landmine press. B. Encouraging the client to push through the pain to improve mobility. C. Increasing the weight to strengthen the deltoids and build joint stability. D. Focusing solely on stretching the anterior deltoid and ignoring scapular mechanics. Answer A. Reducing the range of motion and substituting the exercise with a landmine press. Explanation. Shoulder impingement often results from limited mobility and poor scapular control. A landmine press allows for a more natural pressing motion with less stress on the shoulder joint. Pushing through pain, option B, can worsen the condition. Increasing weight, option C, without addressing mobility limitations can lead to further injury. Stretching the deltoid, option D, is not sufficient. Proper scapular mechanics and strengthening of stabilizing muscles, such as the serratus anterior, are key. Question 10. Biomechanics and movement patterns. A client is performing a deadlift and you notice that they have excessive rounding of the lower back at the bottom of the movement. This can increase the risk of injury to the lumbar spine. Which of the following modifications or corrective strategies would be most appropriate to address this issue? A. Encouraging the client to lift heavier weights to force proper spinal alignment under load. B. Instructing the client to lower their hips further to get into a deeper squat position before lifting. C. Teaching the client to engage the core, retract the scapula, and perform hip hinge drills to improve form. D. Transitioning the client to sumo deadlifts to shift more emphasis onto the quadriceps and reduce spinal stress. Answer C. Teaching the client to engage the core, retract the scapula, and perform hip hinge drills to improve form. Explanation. Excessive rounding of the lower back in a deadlift often results from poor hip hinge mechanics and a lack of core engagement. Teaching proper form with hip hinge drills and scapular retraction can help maintain a neutral spine. Lifting heavier weights, option A, can exacerbate the problem. Lowering the hips excessively, option A, can turn the deadlift into a squat, which is biomechanically incorrect. The sumo deadlift, option D, may help, but it does not address the underlying form issue. Question 11. Exercise physiology and energy systems. During high-intensity sprinting, which of the following energy systems provides the primary source of AP for muscle contraction? A. Oxidative phosphorylation. B. Anaerobic glycolysis. C. Phosphagon APC system. D. Beta oxidation. Answer C. Phosphagon APC system. Explanation. The phosphagon APC system provides immediate energy for short, high-intensity activities lasting 0.10 seconds, such as sprinting. Anaerobic glycolysis, option B, provides AP for activities lasting 30 seconds to 2 minutes. Oxidative phosphorylation, option A, is dominant during endurance activities, and beta oxidation, option D, is a slow process that primarily fuels long-duration aerobic exercise. Question 12. Program design and resistance training variables. A personal trainer is designing a hypertrophy-focused resistance training program for a client. Which of the following training variables is most appropriate for maximizing muscle growth? A. 3-5 sets per exercise. 1. 6 reps per set. Rest periods of 3-5 minutes. B. 3-5 sets per exercise. 6. 1-2 reps per set. Rest periods of 3-0-9-0 seconds. C. 1-3 sets per exercise. 1-5 2-5 reps per set, rest periods of 6-0-1-2-0 seconds. D. 4-6 sets per exercise. 1-3 reps per set, rest periods of 3-5 minutes. Answer B. 3-5 sets per exercise. 6-1-2 reps per set, rest periods of 3-0-9-0 seconds. Explanation. Hypertrophy training is best achieved using moderate repetitions. 6-1-2 per set, moderate rest periods. 3-0-9-0 seconds, and moderate to high training volume. Low reps with long rest periods, options, and D, are more suited for strength and power training, while high reps, or C, are more endurance focused. Question 13. Special populations. Diabetes and exercise. 45-year-old client with type 2 diabetes wants to start an exercise program to help manage blood sugar levels. Which of the following exercise guidelines is most appropriate for this client? A. Performing resistance training before aerobic exercise to maximize glycogen depletion. B. Encouraging high-intensity training 90-100% ATR to rapidly improve insulin sensitivity. C. Incorporating both aerobic moderate intensity and resistance training while monitoring blood sugar levels. D. Avoiding exercise within 2 hours after meals to prevent postprandial glucose spikes. Answer C. Incorporating both aerobic moderate intensity and resistance training while monitoring blood sugar levels. Explanation. Moderate intensity aerobic and resistance training can improve insulin sensitivity and glucose control in diabetic clients. High intensity training, option B, may cause excessive fluctuations in blood sugar. Resistance training before cardio, option A, can be beneficial but is not a strict requirement. Post-meal exercise, option D, is unnecessary and could actually help with glucose management. Question 14. Cardiovascular training and progression. A 60-year-old client with no previous exercise experience wants to improve their cardiovascular fitness. What is the most appropriate starting intensity and progression strategy? A. Begin with high-intensity interval training HIIT to accelerate cardiovascular improvements. B. Start with light-intensity steady-state cardio and gradually increase duration and intensity. C. Focus exclusively on resistance training before introducing cardio to build strength first. D. Begin with sprint intervals at 8-5-9-5 per HR to improve VO max efficiency. Answer B. Start with light-intensity steady-state cardio and gradually increase duration and intensity. Explanation. For deconditioned clients, light-intensity cardio, e.g. walking, cycling, is the safest way to build endurance and cardiovascular function. HIIT, option A, and sprint intervals, option D, are too intense for beginners. Resistance training, option C, is valuable but should not be prioritized over gradual conditioning. Question 15. Injury prevention. Knee pain and squatting. Client experiences anterior knee pain when performing deep squats. Which modification is the best solution? A. Reducing depth and switching to box squats. B. Switching to leg presses exclusively to avoid knee stress. C. Increasing squat depth further to stretch the quadriceps. D. Reducing ankle dorsiflexion to limit tibial movement. Answer: A. Reducing depth and switching to box squats. Explanation: deep squats can increase stress on the knees, especially if mobility or muscle imbalances exist. Box squats allow for better control of depth and minimize excessive anterior knee stress. Leg presses, option B, do not necessarily fix movement issues. Increasing squat depth, option C, could worsen the pain, and reducing ankle dorsiflexion, option D, could create compensations. Question 16. Nutrition and performance. Which macronutrient is most important for muscle recovery after intense resistance training? A. Carbohydrates. B. Proteins. C. Fats. D. Fiber. Answer: B. Proteins. Explanation: proteins provide essential amino acids for muscle repair and growth, while carbohydrates, option A, help replenish glycogen. They do not directly repair muscle fibers. Fats, option C, play a role in overall health but are not the primary nutrient for recovery. Fiber, option D, does not contribute to muscle repair. Question 17. Behavioral change and client motivation. Which motivational strategy is most effective for maintaining long-term exercise adherence? A. Setting extrinsic rewards, e.g., money prizes for workout completion. B. Using negative reinforcement to push clients harder during workouts. C. Establishing intrinsic motivation by helping clients find enjoyment in exercise. D. Relying solely on strict workout rules and punishments for missed sessions. Answer: C. Establishing intrinsic motivation by helping clients find enjoyment in exercise. Explanation: long-term adherence is best achieved when clients develop intrinsic motivation, e.g., personal enjoyment, health benefits. Extrinsic rewards, option A, can work short-term but may not sustain adherence. Negative reinforcement, option B, and strict punishment, option D, can create resentment and burnout. Question 18. Biomechanics. Shoulder impingement and overhead pressing. Client experiences shoulder pain while performing an overhead press. The pain is localized in the front of the shoulder and worsens as they lift the weight above head level. After assessing their movement, you notice excessive scapular elevation and an anteriorly tilted shoulder position. Which of the following modifications or corrective strategies would be most appropriate to address this issue? A. Increasing the weight to build strength in the shoulder stabilizers. B. Switching to behind the neck press to alter movement mechanics. C. Strengthening the lower trapezius and serratus anterior to improve scapular movement. D. Increasing anterior deltoid activation by emphasizing closer grip. Answer: C. Strengthening the lower trapezius and serratus anterior to improve scapular movement. Explanation: poor scapular control and excessive elevation can contribute to shoulder impingement. Strengthening the lower trapezius and serratus anterior improves scapular mechanics, reducing stress on the shoulder joint. Increasing the weight, option A, can worsen the issue. Behind the neck pressing, option B, increases impingement risk. A closer grip, option, does not address the root cause of poor scapular control. Question 19. Energy systems and endurance training. During a long-distance marathon, which energy system provides the primary source of AP for muscle contraction? A. Phosphagon APC system. B. Anaerobic glycolysis. C. Oxidative phosphorylation. D. Creatine phosphate breakdown. Answer: C. Oxidative phosphorylation. Explanation: long-duration endurance events like marathons rely on oxidative phosphorylation, which primarily uses carbohydrates and fats for sustained AP production. The phosphagon system, option A, and anaerobic glycolysis, option B, are dominant in short-duration, high-intensity activities. Creatine phosphate, option D, is a part of the phosphagon system, which lasts only a second. Question 20. Client communication and behavioral change. A client expresses frustration about their lack of progress and is considering quitting their fitness program. As a personal trainer, which motivational strategy is most effective to help them stay committed? A. Pointing out their failures to encourage them to push harder. B. Setting smaller, achievable goals to build confidence and motivation. C. Suggesting they increase workout intensity to compensate for slow progress. D. Encouraging social comparison with others to create competitive motivation. Answer: B. Setting smaller, achievable goals to build confidence and motivation. Explanation: small, achievable goals help clients recognize progress, boosting motivation and adherence. Criticism, option A, can decrease motivation. Increasing intensity, option C, may lead to burnout or injury. Social comparison, option D, can be discouraging for some clients rather than motivating. Question 21. Special populations. Pregnant clients and exercise. Pregnant client in the second trimester wants to continue resistance training. Which of the following is the most appropriate modification? A. Avoiding exercises that require the client to lie flat on their back. B. Increasing intensity to prevent excessive weight gain. C. Emphasizing high-impact plyometric training to improve cardiovascular fitness. D. Eliminating resistance training and switching to only bodyweight exercises. Answer: A. Avoiding exercises that require the client to lie flat on their back. Explanation: after the first trimester, lying flat on the back can compress the inferior vena cava, reducing blood flow. Moderate intensity strength training is beneficial, and eliminating resistance training, option D, is unnecessary. High impact plyometrics, option C, are not recommended due to joint instability. Question 22. Injury prevention. ACL injury risk. Which of the following factors most significantly increases an athlete's risk of an ACL injury? A. Weak quadriceps relative to hamstrings. B. Excessive valgus knee collapse during cutting movements. C. Increased ankle dorsiflexion. D. High hip-to-waist ratio. Answer: B. Excessive valgus knee collapse during cutting movements. Explanation: excessive knee valgus inward knee collapse places significant stress on the ACL, increasing injury risk. Weak quadriceps, option A, is less relevant than weak hamstrings and glutes. Increased ankle dorsiflexion, option C, is generally beneficial for movement efficiency. A high hip-to-waist ratio, option D, is unrelated to ACL injuries. Question 23. Strength training and progression. A client has been consistently lifting weights for 6 months but has stopped seeing strength gains. What is the most effective strategy to overcome this plateau? A. Increasing progressive overload by adjusting intensity or volume. B. Reducing protein intake to improve muscular endurance. C. Eliminating compound lifts and focusing only on isolation exercises. D. Performing the same exercises at the same weight for longer durations. Answer: A. Increasing progressive overload by adjusting intensity or volume. Explanation: progressive overload, increasing resistance, volume, or intensity is key to continued strength gains. Reducing protein, option B, is counterproductive. Eliminating compound lifts, option C, removes essential strength building exercises. Sticking with the same exercises and weight, option D, fails to challenge muscles for growth. Question 24. Nutrition and muscle growth. Which of the following post-workout meals is most optimal for muscle recovery? A. Grilled chicken, quinoa, and steamed vegetables. B. French fries and a milkshake. C. Plain pasta with no protein source. D. A high-fat keto meal with only avocado and nuts. Answer: A. Grilled chicken, quinoa, and steamed vegetables. Explanation: post-workout meals should include protein and carbohydrates to aid muscle repair and glycogen replenishment. The high-fat meal, option D, lacks protein and carbs. French fries and a milkshake, option B, provide excess sugar and unhealthy fats. Plain pasta, option C, lacks protein. Question 25. Special populations. Hypertension and exercise. Which of the following is most appropriate for client with hypertension? A. Avoiding isometric exercises and focusing on aerobic training. B. Performing high-intensity resistance training to lower blood pressure quicker. C. Encouraging Valsalva maneuver during weightlifting to improve stability. D. Eliminating exercise completely due to blood pressure risks. Answer: A. Avoiding isometric exercises and focusing on aerobic training. Explanation: aerobic exercise helps lower blood pressure. Isometric exercises like prolonged planks can increase blood pressure. High-intensity training, option B, may be too strenuous. The Valsalva maneuver, option C, increases intra-abdominal pressure and is unsafe for hypertensive clients. Eliminating exercise, option D, removes the health benefits. Question 26. Flexibility and mobility. A client has tight hip flexors and anterior pelvic tilt. Which of the following is the best strategy to correct this imbalance? A. Stretching the hip flexors and strengthening the glutes and core. B. Avoiding squats and deadlifts entirely. C. Increasing lower back extension exercises. D. Focusing only on passive stretching without strengthening exercises. Answer A. Stretching the hip flexors and strengthening the glutes and core. Explanation: anterior pelvic tilt results from tight hip flexors and weak gluteus core. Strengthening the posterior chain helps restore balance. Avoiding squats, option B, is unnecessary. Increasing lower back extension, option C, can worsen the tilt. Passive stretching, option D, alone does not correct the imbalance. Question 27. Biomechanics. Deadlift technique and injury risk. Client performing conventional deadlift experiences low back pain after training. Upon assessment, you notice the following. Their hips rise faster than their shoulders during the lift. They have rounded lumbar spine at the bottom of the movement. They report discomfort in the low back rather than the glutes or hamstrings. Which of the following corrections would be most effective in addressing their issue? A. Increasing weight to force stronger engagement of back muscles. B. Encouraging neutral spine and engaging core muscles during setup. C. Switching to behind the back deadlift, hack deadlift. D. Reducing rest periods to increase endurance in the lower back muscles. Answer B. Encouraging a neutral spine and engaging core muscles during setup. Explanation: a rounded lumbar spine places excessive strain on the lower back, increasing injury risk. Maintaining a neutral spine and engaging the core provides stability and prevents pain. Increasing weight, option A, worsens the issue. The hack deadlift, option C, changes the mechanics but does not correct improper form. Reducing rest periods, option D, address spinal misalignment. Question 20. Special populations. Older adults and strength training. 65-year-old client with no prior strength training experience wants to start resistance training program to maintain functional independence. Which of the following is the most appropriate approach? A. Focusing on compound movements with light resistance to improve daily function. B. Using explosive, high-intensity powerlifting to increase muscular strength quicker. C. Encouraging only cardiovascular exercise as strength training is too risky. D. Recommending machines exclusively to prevent any risk of balance issues. Answer A. Focusing on compound movements with light resistance to improve daily function. Explanation: older adults benefit from functional movements that mimic daily activities, e.g., squats, rows, and deadlifts. Powerlifting, option B, is too intense for beginners. Avoiding strength training, option C, leads to muscle loss, sarcopenia. The machines, option D, can be useful but should not replace functional strength exercises. Question 29. Exercise programming. Progressive overload for muscle growth. Client training for muscle hypertrophy. Muscle growth has been following the same program for 8 weeks but has stopped seeing progress. Which of the following adjustments would be most effective to restart muscle growth? A. Increasing training volume, sets and reps while maintaining moderate intensity. B. Switching to cardio-focused program to improve overall fitness before resuming lifting. C. Decreasing rest periods to under 10 seconds between sets. D. Training with only bodyweight exercises to shock the muscles. Answer A. Increasing training volume, sets and reps while maintaining moderate intensity. Explanation: for hypertrophy, increasing training volume, e.g., more sets and reps, is a proven method to stimulate further muscle growth. Cardio training, option B, does not directly promote hypertrophy. Reducing rest to under 10 seconds, option C, may not allow adequate recovery. Bodyweight exercises, option D, may not provide a stimulus compared to resistance training. Question 30. Injury prevention. Rotator cuff strength and stability. Client who regularly plays tennis and baseball is experiencing shoulder instability and mild pain during overhead movements. Which of the following exercises would be most beneficial in strengthening the rotator cuff and improving stability? A. External rotations with resistance band and prone Y raises. B. Heavy barbell shoulder presses to increase overall strength. C. Behind the neck lat pull downs to improve shoulder flexibility. D. Push-ups and bench presses to strengthen the chest and deltoids. Answer A. External rotations with a resistance band and prone Y raises. Explanation: the rotator cuff, supraspinatus, infraspinatus, teres minor, and subscapularis plays a crucial role in shoulder stability. The external rotations and prone Y raises strengthen these muscles. Heavy presses, option B, can aggravate instability. Behind the neck pull downs, option C, increase impingement risk. Chest and deltoid exercises, option D, directly address rotator cuff weaknesses.